And then I haven't really done anything with video yet at all, but I think she actually does video. I'm just pressing record so I don't forget. She does some video editing and she'll put it up on your YouTube page if you want. So
I need that woman.
Yeah, I'll connect you.
Awesome.
I'll connect you.
All right.
Yeah. So cool. Let me just pull up one more thing. I was telling Vonda that I just like with this move, and you know, Jen, you just moved. It like took over my life, and then the computer died, and I was a mess.
So, for some reason, you were not a mess. I know you were not a mess. my meeting, I can't see everything, so I might have to sign out and sign back in again.
Oh, okay, sure.
Let me just do that because I'm just technically challenged, and then I'll come right back.
Okay, sure.
Okay, bye. I can't even figure that out.
Bottom right, I think.
Yeah. No, it's just the whole thing. Like all I can see is you, like the little column, but the whole.
Like, are we black boxes?
Or? I figured it out. Now I see everybody.
Fix it. Oh, okay, so there's like gallery view. There's speaker view. So.
I had minimized Zoom and then I found it on the bottom, so I'm fine. We should totally use that as how technically challenged I am in something.
No.
Kept in other things.
No, totally fine. Okay, so so this is going to be my my intro episode to season 2. I've got it all recorded. I have one gal left who's like an aerospace engineer who I'm going to talk to this month. And so like I'm done with it, but I learned from the first season, which Jen, I'm happy to share notes. Like I found like just trying to run a practice and then every week, like trying to get on people and say, okay, are the graphics done? Okay. Is that any, like, you know, it's better just to batch it, get it done, do it all at once.
You are killing it. I've not listened to all of them, but I've listened to a good deal of them and they're amazing. You're doing a phenomenal job. I'm so excited for you.
Thank you so much. So anyway, what I will do for the intro, you know, I'll kind of just briefly kind of do the monologue part where I'll talk about the inspiration for the name of the podcast and who I've talked to in the first season, who we've got coming up for the second, and then I will introduce the both of you. And I'll say, you know, both of you are part of this 6%. Tell me about some of your experiences as a woman in this very male-dominated field, and then you guys can take turns. One of you can go first, and then the other can go. And then I will ask if people such as patients or hospital staff or other people you run into are still surprised to find out that you're the orthopedic surgeon. And then how each of you are working to create a cultural change within our field and then beyond that. And then, you know, even though I kind of have bullet points and things that I'm thinking about, you know, we can kind of let it free flow and go whichever way we want. And then at the end, I will say, you know, as the listeners navigate their way through this upcoming season 2, I would like to ask you guys what kind of pearls or advice you have for them being women in male-dominated fields. And then we'll just kind of wrap up with that and you know, give you a chance at the end to talk about your platforms and where people can find you online and everything. Does that sound good?
Yeah, fun. It sounds fun.
Okay, cool. And then I'll get this, I'll try to get this video edited. I'm editing meaning like just where to start it, where to end it, and then it'll be online and shareable and you can use it however you like to.
Nancy, I have to say that I'm glad that you're not asking us to end the podcast by showing you feats of strength, because I cannot do a headstand like Miss Dr. Jen here. I know. No feats of strength.
I love it. I love it. All right, so I will pause for a second and then I will get started. And like for the audio recording purposes, like I don't mind if we mess up on anything for the video recording. we'll just, I don't know, I'll figure that part out. But the audio, we can we can make changes and cut things out if there's anything you want to rephrase. And that's kind of more for me than anyone else because I mess up all the time. So, all right, I'll pause for a second. Hello, I am Nancy N. Shipley, MD, otherwise known as Nancy MD, and I am so excited to be kicking off season 2 of the 6% with Nancy MD. So why is this podcast called the 6%? Well, there are very few women in orthopedics, and one of the figures quoted is 6% practicing women in orthopedic surgery. And so that was the inspiration for the name of this podcast. I was so thrilled and so excited to have season 1 kick off earlier this summer. And we had these amazing guests. I was so lucky to get to talk to a Major League Baseball coach, a film producer, CEO, CT surgeon, and more. And this season, I am thrilled to bring more amazing women in male-dominated fields, such as a Paralympic skier, a big engine mechanic, fighter pilot, an anchor radio host, publishing CEO, and of course, some of our sisters in medicine and surgery. Speaking of my sisters in medicine and in surgery, I would like to welcome Doctors Vonda Wright and Jennifer Weiss, both fellow orthopedic surgeons. They are here to help me kick off season 2. Welcome.
Thank you.
So happy to be here.
So both of you are part of the 6%. Tell me about some of your experiences as women in this male-dominated field. So Jen, why don't you go first?
Sure. I'm so happy to be here. And so this is my favorite topic, quite frankly. It's near and dear to my heart. One of my very first interactions as a doctor in orthopedic surgery, I did my training at Baylor in Houston, Texas. And I was, in those days, I'm getting old, our internship did not have orthopedics formally in it. We were general surgery interns at that time. And I was so excited. My internship was incredibly malignantly crazy on hours. It was the pre-80-hour work week. It was very traditional that I would come to the hospital at 6 a.m. and leave the following day at 7 or 8 p.m. And everybody's nodding their heads. We've had those days, I think, in common, all of us. And so one day, for some reason, I was done early-ish. And I looked at the OR board, which for those of you who are not surgeons or in the operating room, there's this, in those days, it was like a whiteboard. Now it's electronic, but in those days it was a whiteboard, and I saw that there was still one of the orthopedic surgeons doing a scoliosis case. And so I was friends with one of the nurses who was in the room, and I kind of knocked on the door quietly, and I said, "Do you think I could come in and watch?" And she said, yeah, come on. So she pulls me in, and she says to the surgeon, "Dr. X, I'd like you to meet Dr. Weiss. She's an intern. She's going to be an orthopedist." He looks over his shoulder, and in a Southern twang, I'm not kidding you, said, "I didn't know girls could do this," and turns right back around and keeps operating. And I was like, yeah, welcome to my profession.
Wow. Wow. Vonda, what were some of your experiences jumping into orthopedics?
So, I was a nurse before I was a surgeon. I was a cancer nurse. And so I think that gave me some hard life experience, right? Life and death. And I ran a cancer institute. So when I came to medical school, I came with a little like, you can't scare me. I've done this before, right? But when I got there, I encountered some of the same things. I had one of the pillars of orthopedics, and this is not uncommon. I mean, I think people listening to this, that although they've listened to your podcast, probably other people have told stories like this in other fields, but it is so not uncommon that I almost think of it as not unusual in this world for a pillar of the orthopedics community. Like the three of us are within 2 generations of the origin of orthopedics, right? The grandfathers have now in their 90s, the fathers, the people that raised us, and then us, right? Now we are the grandchildren, which makes us very close to the beginning of orthopedics. So I had one of the origin, the grandfathers, say to me, and he meant it. I don't really think he was trying to be mean, but he's like, honey, what's a nice girl like you, or what's a pretty girl like you doing here? And, you know, I think like most of us, we took it, right? So many times we have just said something and passed it off, right? Because we don't want to offend that giant of surgery, or it's not worth the fight. But I think something more interesting is that probably none of us had anybody that looked like us going forward. And I got to tell you, I kind of use that to my advantage, because you can imagine, for those of you who are listening, when we interview for orthopedic surgery positions, it may be 1, 2, or 3 of us and a room of guys in gray suits. So I always tell young women, use that to your advantage. My interview suit was purple with a peplum. They were going to remember the girl with the red lips, with the purple with the peplum. Oh yeah, she came with a good CV, right? So I think I just never saw anybody like me. I mean, the last hip I reduced, I promise I'll stop talking because I've got years worth of stories, but the last hip I reduced, and for those of you listening, so when somebody dislocates their hip, the 3 of us in our training would have literally jumped on the bed, straddled that person, put our arm under the leg, and we would have used our superpower strength and pulled that hip in. I'm not kidding you, ladies. The last guy, I reduced his hip. He must have been 300 pounds with a very mountainous belly. And I swear people were taking bets in the room, whether this little intern or whatever year I was at that point could pull the hip in. I don't really think that's uncommon. Do you?
No.
Like, can she do it? Is she strong enough? Will she ever be one of the boys? I don't actually want to be, but
I mean, what's funny is that, you know, the 3 of us, we're all nodding and like we literally could do that in our sleep. It's like,
next, right? Next. Right.
Exactly. And, you know, and we all have stories of when we first got started in orthopedics or decided to go into orthopedics, what that was like, and the different weird, interesting, unusual comments that we got. But do you still to this day run into patients or hospital staff or anyone else that is surprised that you're the surgeon?
Not just yeah, but hell yeah. I teach a communications course. I work at Kaiser Permanente, and I am very fortunate to be part of the faculty working with communication amongst clinicians and physicians. And everybody's taken a shine to the term microaggression these days, right? So as I'm sort of teaching about, I just think they're aggressions. But as I'm teaching about those, my go-to story is, I'm a pretty good communicator. And not 2 years ago, I have gray hairs now that you can see. I went into a room and met a family and walked the family through an ACL reconstruction and talked about soup to nuts. And I did my best communicating job, and I was super, like, that's how it's done, Jen, right? And wrapping it up, getting them like ready to talk to my surgery scheduler. Sure enough, the question was, well, who's going to be the surgeon?
Yeah.
That's completely common, Jen. And I often think to myself, I've been a doctor for 21 years. How much older and how many more wrinkles do I have to have before somebody doesn't assume that I'm just here to sign the consent or whatever, not do the surgery? I think that has got to be so common, and I don't even know when it's going to end. But people, obviously, it's a hot topic with me. People do it all the time. And you know what? It's sad because I'm not an incredibly formal person. My ego is fine. So I would be really happy to walk in a room and say, hello, I'm Vonda Wright. How can I help you? But because of this issue, I never introduced myself as anything other than I am Dr. Wright. I am here. And I mean,
Same.
I make my staff do it. I wouldn't actually make my staff do it. It's not a big deal to me. Or, but it's because of this issue. Who are you and what role do you play? And yeah, it's necessary.
Yeah, I do the same. I mean, you know, and I think that we're all on Twitter, and there are some interesting discussions among physicians about, well, why do you have to be on your high horse and use your title? It's not that. It's not that I have this, you know, Dr. chip on my shoulder. It's that I've been mistaken for other things so often that people need to know that I'm their surgeon. I mean, not just because I'm a doctor and I need them to know. They need to know. They need to know who's operating on them. That's part of informed consent. And so it's really, you know, it's just become my habit, and my staff does it. And, you know, and a lot of the folks in the OR and surgical assists and other people that I work with, even, you know, surgical instrument reps, have just taken to calling me, you know, Dr. Yen Shipley, even though we may be personal friends on the outside. They call me Nancy all the time, but it is just this formality that kind of helps preserve the ability for us to have that doctor-patient relationship as the doctor, you know?
If anybody follows me on social media, if anyone's ever met me, you know that my biggest issue on the planet is getting rid of the word provider, for exactly the reason that you're saying. It's not fair that our patients don't know who we are. And everybody's an important member of the team, whether they're a man or a woman. But you're right, as part of informed consent, who are you and what is your role in my care? And if we use the word provider, we are completely jeopardizing that.
Right. Absolutely. I know that each of you are very, very active in working to create a culture change, not just in our field, but just for women and equity across all different disciplines. Tell me a little bit about what you both are involved in to make that shift in the culture.
Well, you know what? I historically, and again, I say my ego has no problem. So I never really needed to do this until today, until this environment. But I think it's more important now than ever to eliminate the adjectives that we use before words. I am a surgeon. I am not a female surgeon. I am a surgeon. I am Dr. Wright. I am married. I chose not to take my husband's name, which is fine if you take your husband's name. You know, it's not that I was never liberated. I was never trying to be anybody's Lord and master, but it has gotten to the point where unless I stick up for myself and say, I was in school 22 years, I deserve this, that no one else is going to recognize the capacity, the ability. They'd rather talk about my ponytail and my earrings than my amazing surgical hands. And so look at me, I've gotten very liberated about, I am your doctor. And you know, if you're a drug rep and you want my business, do not call me, hey, Vonda.
Yeah.
You know, if we're out having a beer, call me, hey, Vonda, or I don't drink beer. You know what I mean though? Hey, Vonda. But give me the credit that's due in all arenas. And you know what? Another surgeon, she's a plastic surgeon, said to me, because I've always struggled with this, but this is part of me becoming very liberated. I think girls sometimes don't want to admit how smart they are. And she said to me, I'm just going to lay it out here. I have embraced the fact that I am high functioning. I am type A. I am brilliant. And I'm like, that's right. That is exactly what I am. I do not need to apologize for being all those things.
Yes.
They were learned. I mean, I worked hard to learn those behaviors. I was given a brain. Why am I apologizing?
Right.
And so every young woman, I give this little, look at me, Jen, I'm on a soapbox. I give this little speech to, because why are we apologizing for the gifts we have? We should own them and allow other women to own them. And I should call the other women in my environment, doctor, you know? When we are in public, call each other doctor. because
Mm-hmm.
that just reinforces, we amplify each other, right?
Right.
So, you know, I'm sorry, anybody that's near me has to be subject to this newfound zeal I have not to apologize for my really smart brain, my really great hands, and the really hard work. For 22 years I went to school, right?
Yeah,
So that's what I'm
absolutely.
doing. Yeah.
And I would definitely want to hear your answer too, but I want to comment that, you know, it's we have to be out there and be unapologetic for having all those things, these brains and these hands. And we can also simultaneously have red lipstick
That's
and, you
right.
know, wear a bikini on social media if we feel like it. You know, we kind of have to not apologize for all the different pieces of us. And I love how you've become liberated and you're encouraging other young women to do it too. I think I'm getting there as well. Jen, what about you?
Yeah, so I have the same sort of newfound zeal, and I have also academically and professionally found my soapboxes. One thing that I do is research. I'm researching, number one, what the impacts of maternity leave are for women, and not just maternity leave for women, but paternity leave for men, adoption leave, and parental leave is really what we should be calling it. So I've written on that and researched that, researching microaggressions, and as I said, just aggressions, bullying, harassment, getting an understanding of where that lives in my own home organization, in the AAOS, in POSNA, which is, so what those are, the AAOS is the American Academy of Orthopedic Surgeons. I'm involved in communications. I'm the communications chair there. Pediatric Orthopedic Society of North America, I've done work with as well. And so what I've done is taken my zeal and brought it to my research and intersected those things. And my leadership role within Kaiser Permanente, I've also implemented this work on microaggressions, harassment, and bullying. And I think that with our year of, or actually even in 2019 with Time's Up Healthcare and the Me Too movement, we are strong, we have momentum, and I think the three of us play huge roles in that freight train that's not going to be stopped now. And one last thing that I have found really important, and I know the two of you are very involved in this as well, is teaming up with underrepresented minorities. Because even though women are only 6% of orthopedic surgeons, underrepresented minorities are 4%. And so teaming up together to say we want our orthopedic surgeons to look like the public, so that people can have doctors that look like them. And
Yes,
that is important to a lot of patients.
absolutely.
You know
Well,
what, Nancy,
yes.
when I was thinking about Jen, I'm so glad you're researching that, and I've seen the things you're posting about it, because it's so important. But what it made me think of was three things, actually. Is I am so proud of the generation of millennial doctors that are coming up now, because they are asking for things that I never asked for. Maybe I wasn't smart enough, or maybe I wasn't brave enough, but I took 1 week off to have my one and only baby. I returned to the football field in 1 week and I could barely walk. I pumped in every bathroom and locker room I could find because there was nothing. And these women are actually having maternity leave. They're getting accommodations for their exams. My ladies, if you're not a woman and listening, you will not understand this, but I was taking my boards and my boobs were about to explode
Oh,
because I couldn't go breastfeed. And she was,
you
I'm
couldn't
so
stop.
proud of these women. But I'm also, I have to actually acknowledge, I am so not anti our male colleagues, because there are so few women. It is the men that have given me opportunities. And I think that the men that give women opportunities, like I have been fortunate enough to have in my career, they need to step up and help us educate the other men in our field that this is the right thing to do, right? I
Yeah.
mean, I think we need some he for she, and fortunately I've had some he for she in my career, and I'm so thankful for that. But I also think that those of us, the three of us have been in practice for a while, we're in positions to pull up the younger women or even the underrepresented minorities. And I've just, you know, in my current position, I have the capacity to recruit and hire people.
Mm-hmm.
And I do it purposely. I offer jobs to, or I take applications from everybody who's qualified. I go out and I seek a diverse applicant pool, and sometimes that doesn't happen. And so we're in a position we need to do that for each other purposely.
Absolutely. That is absolutely true. I admire both of you so greatly, not only for what you've accomplished within orthopedics, but for everything else that both of you do. Your voices, which you have displayed in written, video, and in live form, you've just demonstrated how amazing of role models you are for young women. And I am truly honored to call you my friend and my friends and my colleagues. And I am really honored to have you help me kick off this second season. And I think that there are going to be really interesting stories, but more importantly, really important stories to share. And so I want to ask you the question that I always ask all of my guests. As our listeners navigate themselves through the upcoming season 2 of the podcast, what advice or pearls do you have for them as women coming from very male-dominated fields?
Jen?
Yeah, I'm going to say 2 things. Number 1 is it's okay to believe in yourself. I have taken a tactic recently where I do a lot of talking to my younger self. I frame talks that I give to younger people as framing it to my younger self. And I'm actually asking women in medicine right now to give me videos of themselves talking to their younger selves. And my talk to my younger self is, don't be afraid to believe in yourself. It is okay to feel good about what we have to offer this world. And when we look at the differences in the way girls and boys are brought up, that remains to be a huge difference in the way our children get educated, that the girls are less likely to be told that and socialized to act that way. So that's number 1. And then number 2 actually goes back exactly to what Vonda was saying earlier, which is, it's also okay to have men on your side, he for she. I would never be where I am without the men who advocated for me, sponsored me, mentored me. And I will wrap this up by saying that I think that there were a couple of times in my career where I might have walked away from this without being bolstered by some very particular mentors. And I'll just mention Vern Tolo, who's one of the grandfathers of orthopedics, who has done that for me throughout my career. So find that mentor. Don't be afraid to really ally yourself with somebody who makes you feel good and strong and smart.
Oh, that's good.
I love it. Vonda, what's your advice?
Well, I think that I would tell my younger self that if it's true, it's not bragging. If you're smart, you're smart. If you're capable, you're capable. And it's just like I tell people, you know, your weight is not a judgment, it's a number, right? Numbers don't judge you. If it's true, it's not bragging. Girls are brought up, if you say something congratulatory, or even not congratulatory, I'm smart, I did this well, it's somebody will say to you, well, that's bragging. It's not bragging, it's the truth, right? The other thing I would want younger women to do, because it took me a little while, well, that's not true, I've kind of always stuck my head in, but put your hat into the ring. I mean, I just put my hat into another big ring. I'm not leaving jobs, don't worry, Northside, but my last 3 great opportunities have been because I got over myself and I put myself up for something. I talked to somebody and I said, I think I would be great for that. And here are my logical reasons why. We think somebody's going to die if we advocate for ourselves. What is the worst thing that's going to happen? Nobody is dying if you advocate for yourself. No does not kill you. You may feel hurt for a while, so just throw your hat in the ring, Vonda Wright. Do not be afraid of somebody telling you no. You've been rejected before. You didn't die, right? So I think being strong and courageous at an earlier age would have helped me out.
I love that. I think those are wonderful pieces of advice. And I think it doesn't matter if it's for women who are going into orthopedics or into anything. That is just like very good life advice. And so if our listeners would like to keep up with what you two are doing, please tell us where they can find you.
I'll go first. I think mine is cooler. I don't have as much cool stuff out there. My social media on Instagram and Twitter are My Mom the Surgeon. And I do have a website, Jennifer Weiss MD. And I will also be coming out with a podcast that I'm doing with my baby sister this year. Please look for that as well. And the name is still secret.
I cannot wait. I'm holding my breath. I'm so excited. Very excited for you. Vonda, what about you? Can you tell us where we can keep up with what you're up to?
Absolutely. So I tried to keep it as simple as I could. So my website and most of my social media is at Dr. Vonda Wright, Dr. Vonda Wright, all smashed together as one word. So most of it's out there. You can Google what I do. And I like to put books out there. So we have all kinds of books out there about various longevity and living long and prospering. And, but I started this nonprofit about 7 years ago called Women's Health Conversations. It's based on the idea that women control 80% of all the healthcare decisions in this country for themselves and for everyone they touch, and they don't know it. So if you look that up, it's a great platform, and it has a podcast that we're relaunching in October called Hot for Your Health. It's all the latest techno gizmos and hot things for your health.
That's awesome. Thank you both for being on, and I hope everyone tunes in for an exciting season 2 of the 6% with Nancy MD. Thank you, ladies.
Thank you. Can't wait to hear it.
Yay, that's a wrap.
That's fun.
Thank you so much. I have one more thing to request. I think this would be a fun little snippet for video. So it'll take just 1 minute. And so I'll say, I'm Nancy and Shipley. And then Jen, you can say, I'm Jennifer Weiss. And then Vonda, you can say, I'm Vonda Wright. And then after that, we will all in unison say, and we are the 6%.
Oh,
Does
that's
that
great.
Sound good? Okay,
Yeah.
because I thought that'd be a fun little snippet. Okay, all right. I'm Nancy and Shipley.
I'm Jennifer Weiss.
And I'm Vonda Wright.
And
we are
the 6%. Let's try it again. We'll get it more. I'll say and then we'll all say we are the 6%. Okay.
Good.
I'm Nancy and Shipley.
I'm Jennifer Weiss.
And I'm Vonda Wright.
And we are
the 6%. Take 3.
Take 3. Okay, should we try it again?
Yeah.
Okay.
Wait, can we practice it once before we do it though? Like the cadence of the we are the 6%. I have on the other side of the room. They're like, why is she talking about cadence?
So maybe after we each say our names, I'll chime in again and I'll say, and we are the 6%. Should we try that part? Okay, so then I'll say, and we are the 6%.
6%.
Shall we try it?
Yeah.
Okay, all right. I'm Nancy and Shipley.
I'm Jennifer Weiss.
And I'm Vonda Wright.
And we are the 6%.
The 6%.
It must be a delay, I think.
I think it's a delay.
There's got to be a delay. Okay. Well, that's all right. Maybe I can have my editor do something with it.
Okay.
And I'm gonna, can I ask a selfish thing? Could we
Totally.
Can we do a real quick, or actually I'll just hit you guys up separately to do the videos for your younger selves.
Okay. Whatever you want. I don't mind.
Can we do like a stop and then a re-record that, and then I can just stick that into video hug? Is that okay?
Yeah. I got to think about what I need to say to my younger son.
I can totally.
Yeah. You know what? I better think about this too.
Okay. I'll just send you a link to the video hug and you
Okay. Okay. I will do. Thank you guys so much. I am, I keep pushing back the launch by like a week or two, just because of everything that's going on. But I'm hoping that that'll happen by the end of the month, and I'll send you an email. I'll let you know.
I'm so proud of you. I love this, and I'm so grateful.
Thank you.
Thanks, Nancy. It's fun.
All right. Bye, guys. Talk soon.
Bye guys.